Okay, well, let's go ahead and get started. Again, welcome everyone. I'm Jacquelyn Dalton, the director of the Health Equity Community Collaborative, or HECC at Health Leads. Thank you all for joining us for this last session today, our last session of the HECC Communications Training Series for community leaders. Health communications has been a incredible topic, a lot of buzz around health communications this year. It's a critical component of public health, of community health, healthcare, right? And it's one that's received a great amount of attention this year in particular, not to mention the years previous as it relates to the COVID-19 pandemic response. But at the top of the year for the Health Equity Community Collaborative, it was a topic that continued to come up for us as something that the Health Equity Community Collaborative Network wanted to hear more about, wanted to see more tools, more how-tos, one-pagers, toolkits, that sort of thing. And because there were so many great things out there, we thought that it would be great to bring you all this session, these various sessions and through this series. And so, um, as I look back, as we're towards the close of the year, I've seen so many great infographics, so many great toolkits and one pagers and just various resources that I've had the opportunity to use or to review. And it's just been great that in a moment where, or in a year where so many things have felt like a crisis, there's also been a lot of positive resources to come out of that. And so, again, we are happy to be here to share some information, some great information with you all from a couple of organizations, just two organizations that are also contributing to that great work. And today, as we focus on effective tools for health communications, we're hoping that you'll receive something that you can take into your work. So before I get into yes, thanks for going to the next slide. I do want to just say a little bit about the Health Equity Community Collaborative as well, in case this is your first time joining us, or if you haven't heard about the collaborative before. The Health Equity Community Collaborative is a collective that was born out of the belief that no single institution or organization can tackle health inequities alone. And so the work that we do to advance health equity is through cultivating spaces, uh, through belonging, collective care, trying to promote shared power with health equity practitioners and champions like yourself, through things like this training series and other resources. So this is just one of the ways that we hope to build a collective power and a power together where we are able to continue pushing the work of health equity. So on our next slide, we have just a few housekeeping items, which include just mentioning that today's session is being recorded, and we will send out the recording to everyone, not just those who are live with us today, but everyone who's registered will receive that recording. So if you have to jump off early, we understand, and we hope that you can use that recording to see any information that you might miss. We also have closed captionings available, so you can use the CC icon at the bottom of your screen to enable those closed captions. And also, we will have Q&A at the end, but anytime throughout the webinar today, feel free to put in any questions that you have. We'll refer back to those questions at the end of our call today for our Q&A session. And then along those lines, our Zoom chat is open. So, if you haven't already, many of you have, please go ahead and introduce yourself, name, organization, where you're joining us from. Anything else you might want to include to introduce yourself and let us know who we have on the training with us today is welcome. So, and great to see you, Rick. Thanks for joining us. Excellent. So please keep those introductions coming. On our next slide, we also have our HECC practice agreements. And these practice agreements, again, may be familiar to some of you who have joined us before, but if you haven't seen them, in our HECC sessions, they're typically interactive, or we'll have time for you to ask questions, interact, maybe come off a mute. So when you do that, we do ask that you keep these agreements in mind and try to uphold them and how you show up with others on the call today, on this training today. So making space for one another to participate, making sure that you take up adequate airtime, be open to acknowledging systems of domination such as racism, capitalism, and patriarchy, as well as the norms that those things maintain, like white supremacy and inequality. We ask that you are welcoming, be curious with one another, ask questions, hold space for tension, and try to keep one another accountable. All of this with a hope that we are, again, cultivating that space for belonging and healing within all of our spaces. Also, in case you missed it, right, we do want you to check out recordings from our first two sessions. In our first two trainings, we had some great presenters as well. In our first training, we were joined by Scott Ratson from CUNY and Rebecca Evich, who are a part of the Health Communications Journal. And we really laid the foundations with some key communications principles, got into the deep work of how to craft a message around health communication. So we talked about active listening, trust building, practical messaging, and storytelling as well. And we also had Sue McCarran from Health Leads in that session provide some important tools, even a one pager. So there were some great resources shared in that first session. Same thing in the second session. We really dove deeply into navigating tough conversations, especially as it relates to our shifting political climate. And in particular, we had a great presentation from Sarah DeGaia from the Change Lab Solutions. And that was just an excellent presentation. And in both of those sessions, we had a little bit of an opportunity for folks to practice and have some just testing out their skills from what they had learned within those sessions. So, again, please try to revisit if you've missed it, some of those recordings from those two sessions. There was some great information shared. So today, what we're doing, again, we're focusing on effective tools or tools for effective communications. And so our learning objectives for today are really hoping to share out some tools and resources with you that will help you to stay on top of emerging events in public health, shared research-based quality, to share research-based quality health information, and also to develop the confidence and competence in communicating effectively with your communities. All right. And today I'm really excited to introduce you to Kimberly Hall, who's the Executive Director of Health Equity Works, as well as Bethany Kuerten, who is a Senior Program Associate for the Public Health Communications Collaborative at the Beaumont Foundation. These two individuals are bringing a wealth of knowledge today as they present and share some of their expertise with us today. So I'm going to go ahead and get us started, and I'm going to turn it over to you, Kimberly.
Thank you so much for the introduction, and thank you all for welcoming us here today. We're very excited to share some of the work that we're doing at Health Equity Works. I think we can hop over to the next slide. We are a fairly new organization, and so some of the things that I'm going to talk to you about today are tools that we already have available, and then some of them are things that we have coming more towards the top of the year and next year. But just for a little bit of background, back in 2003, the Robert Wood Johnson Foundation commissioned a survey of people working in the health equity space. Some of the people on this call may have participated in that to get a good understanding of what some of the challenges were in the space. How could the work be more impactful? What additional support was needed? And has been mentioned on this call, what came out of that was strategic communications, that there was a great need for more focused and more effort to support those working in the space with strategic communications, tested messaging, and actually providing tools and resources of how to use that, not just providing the information, but showing how, when, and where to use it. And so out of that is where Health Equity Works was born. The next slide, please. So we are essentially a resource network for organizations and advocates working towards racial health equity specifically. What I'm going to dig into today is a lot of the tools, resources, and shared learning opportunities that we have available within the network. If you haven't had a chance to visit us yet, please feel free to visit healthequityworks.org. And I'm going to just take some time over the next few slides to go over some of the offerings that we have. I did mention, sorry, but I did mention the network. And so I just wanted to take a moment to focus in on the fact that our network really works on connecting our national, state, and local partners for us all to collaborate and build an inclusive and sustainable conversation around racial health equity. HUE is not a front-facing organization. We do not send out press releases. I do not do public interviews. We really, again, focus on amplifying the work of our network and supporting our network partners in their work day to day. Next slide, please. Our advisory council, here's just a small representation of some of the partners we have in our network that help make up our advisory council. And as you can see, we have a pretty vast representation of those working in the health equity space, from messaging and research to practitioners, to implications. We also have quite a few members that are part of universities and hospitals and things. And so we're really working hard to make sure that we are able to understand the needs of our partners in our network. And we get a lot of that information through our advisory council, but we will also continuously get a lot of that information from individuals like you and opportunities like this through the Q&A and emails and things that you share as you continue to hopefully engage with us. Okay, next slide. So now we get to move to the fun part, which is the tools and resources. So I mentioned a little earlier, our partner network website is really our central hub. Is where we hold all the information. It's where you can find all the resources that we have built out so far and some of the things that we will continue to bring moving forward into the next year. And again, you can reach us at healthequityworks.org. And I'm just going to use the next couple of slides to dive into some of the portions of the website. One of the favorite parts of the website is our social listening dashboards. So as we have been working on building up Health Equity Works, one of the things that we've heard the most from partners is having a good understanding of what's going on. What's the narrative landscape? What is trending? What are people talking about? How can we engage in conversations online? Where does it exist? And so we have created social listening dashboards. We have a national dashboard that has already launched. We're working on building individual state dashboards. And then we also have anti-health equity dashboards. And through those dashboards, you can visit and learn, again, a little bit about like what is the conversation trending on social, in the media, when and where it's happening, who is driving those conversations, what are maybe some influencers that you may want to engage in, what are some influencers that we want to stay away from. How are people talking about health equity? How are people talking about issues connected to health equity? And what does that mean for us? And we felt like that was very important, particularly for strategic communications, because we can't really have an influence on what people are saying in the public if we don't have a good understanding of where they're starting and where things are. And we wanted to make sure that our partners also have access to that so that you are able to use that in your day-to-day work. So that's one of the top things that you'll be able to find in the Message Center on our website. Next slide, please. So we have a couple of different, I'll answer this question before I go in because I just saw it pop up. So we use Signal, we use Cision as our two main sources to build into the dashboards. And then our media research associate is continuously just kind of also going through Google Analytics and all of those things, trying to get an understanding of what is going on in the conversation. But our main source for building those out are Cision and Signal. And as some of you may know, those are very expensive platforms. And so as smaller organizations, it's often hard to make those type of investments individually. But by pooling the resources for the network, we're able to share that and provide that resource to everyone. As a part of that, one of the things that we also use the social listening dashboards for is rapid response. And so we really try to, we're working towards tracking conversations and narratives as they're building so that we have an opportunity to start to engage with them earlier and not just waiting until they become viral. And one of the ways we do that, again, is through our social listening dashboards. And how we can help provide support to our partners is direct partner support for rapid response and strategy and consulting. And so if you see something bubbling in your area and you want to say, hey, I think this might be a problem, let me contact someone from the HUE network, please reach out to us at rapidresponse@healthequityworks.org, and we'll follow up with you. We can tell you what we're seeing on our end, help you track it, help you discuss through a strategy of if it is something you want to engage in or should engage in, and if so, in what way and how. We're happy to help talk through strategy in that way. We will also be, as I mentioned, tracking things on our social listening dashboards. And so there may come a time, particularly if you're part of our network, that we may reach out to you and say, we see this thing bubbling in your area or in your issue area. Is it something that you're watching? What are you hearing on the ground? Is there a way for us to be helpful or a way that we can support you in this? So again, that's a two-way streak on that we are really working to try to beef up our capability in the field to be able to respond to issues strategically and quickly. The other way that we are building up and providing rapid response is building out our National Response Center. And that is a space where we provide field-wide support. So if something raises to the level of a national conversation, we have spokespeople and partner networks, partner members where it makes the most sense to engage in that and speak out on that so that we can all be speaking from a unified voice and help amplify each other's messaging. Next slide, please. We also use our social listening dashboards for our action clips. Our current goal is to send these out weekly. If you're on our list, then you may have already gotten a few of them, but every now and then we skip a week just because there may not be something that is trending enough that we feel like we need to weigh in on. And so what really excites us about the action clips is that particularly if you work in the comm space, we often get media clips, information, news summaries, and all of those things, the things that are going on related to our area. And so we really wanted to make sure that this was a tool that could be helpful in your day-to-day work. And so instead of just sending you a summary of what's going on in the media, we really focused on things that are trending, that should be trending, and that we're watching. And when we send you those things, particularly if it's something that's trending and something that should be trending, then we're going to also include tips and messaging, talking points, and things that you can use directly to weigh in on the conversation. We're in the process of providing templates as well. And so you can just copy and paste, rebrand if you would like, and add that to your social media if there are things that you feel like you should be a part of the conversation or you want to be a part of the conversation. The what should be trending section is a really great opportunity for us to amplify the work of our network partners. And so if there are things that you're doing on social media or articles or interviews that you want to help elevate, then we can send them out to our partner network in our what should be trending section. These do go out on Tuesday, so one is coming out this afternoon. So that other people can see, hey, this is something that's really important to our space and more people should have eyes on this. So let's help amplify it. And then the what we're watching section really kind of flags emerging stories. They're not trending yet, but they may start trending. And so we want you to know that we're watching them and maybe you can keep an eye out on them. They may move to what's trending or they may not, but we're going to keep an eye on them in the meantime. Next slide, please. I mentioned for our rapid response and we have our speakers bureau. So I really wanted to highlight this because this is another great opportunity for our partners to engage in the network. And so we are building out our speakers bureau. And the goal of the Speakers Bureau is to really connect trained advocates in the partner network with media opportunities to counter misinformation and help shape the public conversation. The Speakers Bureau is a big commitment because we are taking the time to really invest in developing thought leadership for our members in our Speakers Bureau. So we do have an application process and a commitment to being able and willing to participate in multiple type of interviews. So that can be traditional media interviews, podcasts, written journalism, engaging with influencers, building up a social media profile. But what we came across is that, we really need to increase the level of content and people who are out there talking about racial health equity in particular and how we're talking about it. And so we're making a concentrated effort to build up a really strong speakers bureau. And so if you have any interest or you have any people on your team that may be interested in participating in Speakers Bureau, please don't hesitate to send over an email. or to visit the website and learn a little bit more about it. The other part on the website is that you will find all of our events. We have a training coming up this week, actually, on Thursday and Friday. We have our Train the Trainer series. It's a 2-day event for a couple of hours where we take an opportunity to train individuals who are responsible for training or prepping spokespeople within their organizations. So this isn't a training for spokespeople, but if you engage with, if you help train, if you help prep spokespeople, this is a place for you where we give you tips and tricks on how the best ways to train, how to adjust to different personalities, how to present information, the best way to put together prep books, the best way to engage with journalists as you're preparing for this, making sure that you can get as much on the interview topic as possible and things of that nature. We will offer more of those next year. And so please take an opportunity to visit to learn about the type of events that we've had. We've also had rapid structure infrastructure trainings, right, to talk about like how do we get prepared for a rapid response situation, and if we don't know what it is, how do we just get the people and the plan in place? And we will continue to do some additional messaging trainings and things of that nature. So, and we also share our research and things of that nature in our events. So, please take when you have an opportunity, take a look at that. We're building out the calendar for next year. And so within the next couple of weeks, you'll see some additional events for 2026. Next slide, please. The other parts of our website, again, include the technical assistance, which I mentioned is really an opportunity if you have any challenges, even beyond rapid response, but communications challenges, questions, or just an idea that you would like to run by us. Please don't hesitate to reach out to us because that is what we are here for, to help provide that technical assistance and capacity building, to think things through, to lay out strategies. If you're looking for messaging, we have a lot of tested messaging that we continue to develop. Our partners have a lot of tested messaging. And so even if we don't have the answer, or we don't know the best strategy, we have partners in the network that we're happy to connect people with to continue to help build on that. Our research library holds a lot of that messaging from us and our partners. And so it's a great place if you want to dig deep and to get a better understanding of some of the audience insights work, why people recommend certain messages and things of that nature. The research library is a place where you can really dig into that. And again, as I mentioned, that's a place where we have things that that Hugh has created or that we have done research on, but we also have a good deal of research in there from our partner network. And so as a partner, if you have some research that you would like to submit, there's also a place to hit submit to have research to share with other members of the network. And then our resources page is slightly different from the research library. The library is when you want to dig deep, if you have a couple extra minutes and you want to understand a little bit more. But as we build out the resources section, that's the space in place for you to just get those grab and go things, right? Like someone is talking about racial health equity and I just want to know how to respond, or this piece of misinformation came out and I would just want to know what I'm supposed to do. And so that's where you can get the quick and easy templates, the quick and easy talking points and things of that nature that you can just kind of pull and use. And again, if you would like to dig deeper, they are usually connected to a source in the research library to help you understand where it came from. So if you want to dig deeper in that, you have the opportunity to do that in the resource library, in the research library. Sorry about that. Next slide, please. And getting to a close, I just wanted to highlight, right, that in our space, we're really facing a dual challenge here. We're trying to defend attacks while also trying to build public support at the same time. And it really requires us to do both, build a proactive narrative strategy and strategic messaging so that we can have a voice in this conversation and continue to build on the work that everyone is doing every single day. And Health Equity Works is here to really just serve as a resource to help you do that. We recognize the challenge of trying to do both at the same time, and we really want to support you in doing that in the best way possible. And I think we're going to move over to question and answers a little later, but there is one last slide here that talks about some opportunities to join the network, the website where you can visit us. We do have monthly network partner meetings. We also usually have at least one type of training or so every other month. So you have an opportunity to connect with others, but also to do capacity and skill building things, the communications tools and templates that I mentioned, opportunity again to learn and share with your network partners, and with us all really trying to work together to create a consistent narrative for health equity. So thank you for your time, and I look forward to the question and answers a little later.
Awesome. Thank you so much, Kimberly. Really, you all, the Health Equity Works website is a gem. There's lots of valuable resources, especially the social listening dashboard that was mentioned. I believe they are able to pick up information from really all of the social media, the top social media platforms like Facebook, TikTok, LinkedIn. What am I missing? Instagram, right? So that's a major tool if you're thinking about what are the trends, what are the things I need to be listening out for. And then also, I tend to think of the Health Equity Works Group as a sort of a phone the friend on health equity communications. What do I need to be responding to? How can I rapidly respond or embed something in my strategy? And it's really just a tool to help cut through all of the noise, right? There's so much information out there that you can be tuning into, but it really helps you kind of zone in on what is it that you need to be combating or even a part of as it relates to creating a narrative. So really appreciate you, Kimberly. Now we're going to turn it over to Bethany from the Public Health Communications Collaborative. Now, if you have not heard about the Public Health Communications Collaborative, seen one of their blogs or their toolkits, you're missing out. I love this group and really excited to hear from you, Bethany. So I'm just going to stop there and I'll turn it over to you.
What an introduction. Thank you, Jacquelyn. As Jacquelyn mentioned, my name is Bethany Kuerten, and I'm a senior program associate at the Beaumont Foundation. I work really closely with our director, Amanda Kwong, and I'm really excited to be here with you all today. We can go to the next slide. And we can just pass by that's great. Thank you. The Public Health Communications Collaborative is a learning and information hub for folks like you who communicate about public health. Our guiding principle is that messages that are simple, that are clear, and that are accurate can save lives. And we live out that principle by creating relevant, timely, and practical communications and tools and learning opportunities, which I'll talk more about in just a couple of slides. So our commitment to the field, but more importantly, our commitment to our communities is to produce accurate, credible, and trustworthy content. Next slide. PHCC is a wonderful melding of several public health organizations. PHCC was founded in 2020 by the CDC Foundation, the Beaumont Foundation, and Trust for America's Health to provide communication tools and resources about the COVID-19 pandemic. Since that time, a lot of trust in our organization has grown, and we have grown along with it. We added 2 more partners, the Kresge Foundation and Robert Wood Johnson Foundation, and we broadened our scope quite dramatically beyond COVID to include almost all public health topics. So from crisis communications to vaccines, to planetary health, to mental health, to food safety, and many, many more. Next slide. I'm going to show you just 3 of our many offerings that we have. So to start, I will walk us through some of our communications tools. Our communications tools encompass a wide range of opportunities. They include resources, guides, toolkits, talking points, social media messaging, social media graphics. Our tools are designed to help you address public health issues, to help you build the public confidence around those issues, and to identify and counter false information. Next slide. The Plain Language Guide and Checklist. This is an example of our most popular communications tool. We created this guide to support public health communicators in creating messaging to advance health literacy, to build trust in your organization as a source of information, and to promote overall community health. It's our most downloaded resource. It comes up time and time again, and it's something that I keep bookmarked on my computer. It's never enough to reference the plain language guide and to run through the checklist to make sure that our messages are really landing for our audiences. Next slide. Thank you. This is another example of a communications resource that we published very recently, right before the Thanksgiving holiday. Given the hardships that this year has faced, we partnered with the information lab at Brown University to create this resource, Resilience, a practical guide for public health communicators. And this guide offers trauma-informed strategies, leadership insights, self-care tools, and actionable steps to help sustain healthy and supportive public health workplaces. So we have tools that work for you as public health communicators, how to take care of yourself, like this resource, how to check your work, like the previous resource for plain language. And we also offer communication tools that we call pass-through resources, where you take them right from our website and you pass them right through to your community. So we have different communications tools for different audiences. Another thing that I wanted to walk you through today was our topics pages. So we put together, kind of learning from the field and learning from our audience, that we wanted to create topics pages and really easily navigatable places where people can find information. So this includes popular topics that are in the news cycle right now. This slide demonstrates a screenshot of just a few of those topics. So staying informed about current public health issues is essential for delivering accurate and timely public health communications in your community. Essential, especially in a year as crazy as this one, when so much of what we're communicating about is changing pretty rapidly. On the next slide is, if I had clicked on the flu topics page, this is a screenshot of what it would pull up. And I just wanted to walk you through a little bit about what's nested beneath each topic page. So this includes trending alerts about flu across the top. You'll see that all of them have an impact rating. All of these happen to be medium impact, but our scale ranges from low, medium, and high. We work with an organization called the Public Goods Project to pull these alerts. They are kind of combing the internet in a lot of the same ways Kimberly talked about combing what's going on and tracking those narratives. We work with an organization that does that and pulls them here to our website. So we assign that impact rating and where and how the alert popped up. So you're able to kind of see how much impact it's having, where it's spreading, and why it caught so much fire and traction. Below those alerts, we drill down into talking points. And in this example, we drill down into talking points about what flu is, how it's transmitted, the vaccination recommendations, treatment plans, and prevention strategies. And that same system of alerts and talking points is consistent across all of our topics pages. On the next slide, this is the last opportunity that I walk us through today. I'll highlight a couple of extras at the end of my presentation, but I wanted to end and leave you all with more information about the PHCC Academy. Our PHCC Academy is a free training hub to support public health communicators across the country. The Academy equips public health professionals with the confidence and competence to communicate effectively about their communities. We have two types of learning pathways: on-demand courses that can be completed asynchronously at your own pace, and live lecture opportunities where you'll get the opportunity to work in a small cohort of other public health communicators, drill down into specific topics, and really have the opportunity to practice. We have 3 Academy courses live right now on our website: community engagement, strategic communications, and crisis communications. We'll be releasing a new course in January on media relations, and our next one will be released in July on public health and AI. A very interesting topic. I wanted to end you all. I have just a few more slides to work through, but this one means a lot to us here at the Collaborative. And Jacquelyn and Kimberly both mentioned this sentiment in both of their presentations about each of their organizations. Similarly, PHCC recognizes that public health communicators have really complex jobs outside of an incredibly complex public health environment that 2025 is and will continue to be in this current administration. And with PHCC, we always want to remind you that you never have to go it alone, so that we hope through all these resources and opportunities that PHCC offers, that communicators feel supported and encouraged. I encourage you all to explore more resources on our website. If you scan that QR code, it will take you to our website. The communications tools that I talked through and just gave you two brief examples, the topics page, like I walked through the example on flu, and the academy are only a small snapshot of all that PHCC does. Similarly to Kimberly, our organization hosts monthly webinars. We monitor trending narrative alerts and we create pass-through resources. And we include a lot of what is happening in the field in our newsletters. So I highly encourage you to sign up for our newsletters. They tell you about what we're doing, but also what our partners in the field are doing. And lastly, this is our website, publichealthcollaborative.org. You're more than welcome to email us about anything and everything that you're working through, or if you need our support on anything, or you need speakers, or you need assistance, you need us to create graphics or copy. We answer the call at all times, no matter the ask or the content. And then lastly, I wanted to highlight our LinkedIn page. Along with our newsletter, our LinkedIn page is probably the most up-to-date source of information. We publish a lot through our LinkedIn page, and a lot of our community we have found is transitioning to LinkedIn. They're kind of leaving the Twitter space, they're leaving Facebook, and they're showing up on LinkedIn. And so we've really begun to build quite a LinkedIn following and community there. So in addition to our newsletters, I really encourage you to give us a follow on LinkedIn. And as Kimberly mentioned, I think we'll move shortly into Q&A, but I really thank you all for the opportunity to talk more about PHCC. I'm really excited about this work, and I love living this life and supporting you all in this space. And so thank you for the opportunity to share more about this work.
Excellent. Thank you so much, Bethany. As I mentioned, these are some great resources. I have found them very helpful on my day-to-day, especially when it comes to talking about things related, just public health in general, right? It's really helpful to have those resources. So we're going to go ahead and transition into our Q&A session. Thank you to those who have submitted questions already. If you have had some questions come up, feel free to go ahead and drop those into the chat as well. Then I just want to acknowledge, I understand that there may be an issue copying some links from the chat, but we will be sending this information out in our follow-up. So please look for that as well if you're having any issues copying the information we've shared so far. And Bethany, as a follow-up as well, the resources that you mentioned, the academy, the on-demand courses, what do people have to do to access those resources? Is there any fees associated with them, or anything that they might need to do to access them?
Thank you for that question, Jacquelyn. Everything that PHCC does is free. And we stand by that. We live that commitment to the field, and the same goes for our academy. So you just have to sign up with your email, you get immediate access, and you can get going on your own time.
Excellent. And it looks like Jabril is signing up for the academy right now. So
Ooh,
we love to
wonderful.
see that.
Love it.
Excellent. Okay, so one of the questions that came in is what tools do you have to help us include or be inclusive of deaf people or people who are hard of hearing in your messaging and when messaging and providing services? So that might be a question for both of you. Kimberly, can we come over to you first?
Yes, sorry about that. So we are still in the process of developing our tools. Our website is accessible. I think we've almost done with that process because we actually just launched our website in October. So we are still building through that, and then additional tools that we roll out early next year, we will be continuing to build out on that.
Okay, excellent. Bethany?
That's a great question, and we've done it in a couple of different ways. So I'll speak in terms of how we think about our work internally to PHCC, and then how we've partnered with a couple of organizations on topics like this. So internally to PHCC, we do a similar kind of review process to making sure everything is equitable, using plain language, the right colors. When you think about color blindness for our graphs and our data points as well. When we do webinars, we always include an organization that does live closed captioning and live ASL interpretation. It's a really great way to make sure that those resources are equitable and accessible to all populations. In the past, earlier this year, we also worked with an organization called the American Speech, Language, and Hearing Association, and I can drop that in the chat in just a moment, about communication access and their access framework. And we live by that policy a lot. And access is an acronym that stands for how you can kind of think about your resources and follow that pathway to make sure that they are accessible to all different types of audiences. So we've worked internally on our processes in that way, but we've also partnered with some organizations that have really good frameworks that we follow. And I can put those links in the chat in just a little bit.
Okay, excellent. Thank you. Great approaches. I love to hear that. So our next question is, and I think we touched on this a little bit, but someone's wondering about the best ways to respond to misinformation. They heard about the social listening, without opening the platform for commenters to spread. So let me reframe this a little bit. So, what is the best way to respond to misinformation, without sort of opening the door for more misinformation to be spread, right? So sometimes you see a topic on social media and you're just like, oh, I'm just going to let that go because I don't want this to turn into a frenzy. So, how do you address those types of situations? Whomever wants to jump in first.
I can start, and then I'll turn it to you, Kimberly, to add. Wonderful question. Very topical question. We've thought about this in a couple of ways at PHCC. One, we hosted an entire webinar on what to do about misinformation, how to address it, how to respond, when to respond and when not to. It's recorded and live on our website, so I encourage people to watch that back. We heard from some experts in the field that track information and trending narrative alerts. The other way that we talk about myths and falsehoods and misinformation, disinformation, and malinformation, those are all kind of different pathways to the same piece, is called a truth sandwich. And I'll put in a graphic of our truth sandwich in the chat. But really what it means is that it's similar to if you've heard of the compliment sandwich. You start with the truth as fact. You introduce a warning about resharing a false claim. You explain the misinformation, and then you finish your statement with a fact. So you kind of sandwich two facts between indicating the warning. We have a really great graphic on our website that does that. So it's a great way to kind of check how you're going to respond to misinformation. I also acknowledge that there's times not to reply to misinformation and not to encourage a firestorm and an argument and combativeness online and conversation. And so it's really just about kind of gut checking if this feels like the right place to reply and respond. That might be kind of the first step before then kind of figuring out how to reply and the method in which you want to reply. So I just wanted to acknowledge that too, that it's not always the right place to reply to some misinformation. I'll turn to Kimberly.
Just following up on that, one of the things that we talked about a lot in our rapid response infrastructure building is that the more work you can do ahead of time, the better. And so it's a great opportunity, particularly in an age where we have so much mis and disinformation, is to really think through organizations' goals and priorities to really determine what type of mis and disinformation should you respond to and should you be watching for. So it's very easy to kind of get caught up in all of the things because, again, there is so much of it. And so really helping narrow it down based on your organizational goals and priorities is the first step to doing that. And then once you've been able to do that, being able to use things like the social listening dashboard to really assess the impact of what's being said, right? Like if it's not trending, if it's not being talked about widely in your communities, if a lot of people aren't being exposed to it, then maybe this is something you don't need to respond to because we don't want to introduce it to new people. And the other part of that that's always key when it comes to mis and disinformation is making sure that we're not repeating it, right? Like we, again, don't want to help spread it. They don't need our help, but we can take that as a great opportunity to pivot and point the conversation into what we would like to talk about. And the last part of that is we just wrapped up a study to kind of do some get an understanding of the impact some common mis and disinformation around health equity and racial health equity have to get an understanding of what things are actually having an impact on what people think and our messaging in comparison to that. And so probably mid-January, we'll host a webinar to kind of review some of those things again to really so that we can have a good understanding of like what's actually really registering with people, what's not registering, and then for the things that are registering, what are some stronger ways for us to respond?
Excellent. Thank you, Kimberly and Bethany as well. And appreciate you, Bethany, sharing the screenshot to the truth sandwich. Have not heard of that before, but that's kind of an easy to remember method. And Kimberly, what you shared about just reflecting on, what are the principles of your organization? I think that's really important as well, when addressing some of that misinformation. Excellent. And so there was a comment in the chat around the social listening dashboard. Are there any is there an accessibility issue or like a timeline? I believe the listening dashboard is open. Is that right, Kimberly?
Yes, that's currently up and running and opening. So you sign on to our website and request a username and password. And once you are approved for the site, then you will immediately be able to access all the tools and functions on the site. We did have a training on how to use it. And then if you need any additional information or things like that, we're able to connect with you. Max, who works on that directly day to day, will be very excited to share all the things that they learn about how to use it and really narrow it down so it can be most useful for you.
Okay, excellent. And
Mhm.
anyone, I think we had a question about whether individuals or organizations are open to join or able to join Health Equity Works, but any individual or organization is able to join you all. Is that correct?
Yes.
All right, excellent. So if you all are out there, I know there's some expertise on here, folks who want to sign up for the Speakers Bureau or be involved with the group, contact Health Equity Works. All right. And so another question that we had is, as someone that is early in their career and new to public health communications, what are some things that you both feel are helpful to get more comfortable with as it relates to effective communication? So public health topics or even skills as it relates to being an effective communicator in public health.
I think one of the most important things is the understanding and appreciation of audience insights and really making sure that you understand who you are communicating to and the best way to communicate to that individual or that group. That's one of the key things to really successful communications because we often have all type of messaging and products and tools and all of those things, but if it's not the right audience for that tool or for that messaging, and then it's not going to have the impact that we seek. And so I think that really gaining a strong understanding of that is very important.
Yeah, knowing your audience. Yes, definitely. Bethany, what are your thoughts here?
I co-sign that, Kimberly. That's a really great place to start. I'm going to bring us back to that plain language guide and checklist. I think public health as a profession, we can tend to get pretty jargony and we use a lot of acronyms. There's an acronym for everything in public health. It's like alphabet soup at times. And I think if we can remind ourselves that to use plain language, to bring things down in your reading level, to look at everything that you write and you communicate about with the lens of being really upfront and clear, and merging that with Kimberly's suggestion of like knowing who you're talking to is a really, really great place to start. I don't feel like I learned those skills until later in my public health career. And those are things that I think I would have really benefited from, like knowing at the start and knowing at the beginning.
Yeah, I agree, Bethany. When you're in public health, you're really just in it. And so you're throwing out terms, you're throwing out the acronyms, right? And not really thinking about how those things are landing. And with public health, we are always collaborating with folks who are not necessarily in our fields, who are not understanding that technical information. So I think it goes back to what Kimberly said, right? Just know your audience, right? What information are they familiar with? What's going to hit home for them? I think that's really important to really think about. And I too, did not realize that until a few years into my career of like, hey, everyone doesn't know what you're talking about. You sound smart, but hey, I don't know. Um, so really appreciate
Exactly.
that.
Yeah, I was just going to add too, it's just little things. It's like you get taught in a public health curriculum what social determinants of health are, but nobody understands what those words mean. And you might infuse them into your practices and how you think about your work, but people do not understand social determinants of health as a concept. And even something as little as, we say in public health, smoking cessation. Why don't we
Mm,
just say stop smoking? It's just little things like that where we get so into how we say things and how we do things. And it's those little checks that we need to just have that on our work and on our words that could make a much bigger impact. Stop smoking is a much bigger impact than smoking cessation.
right. Yeah, great point. Well, here's another, this might be a very interesting, we could probably have a whole debate on this, right? But many folks like to go to social media for their health information. I have to tell my child all the time, like, just because you heard someone say it on YouTube doesn't mean it's right, you know? But sometimes you see folks always going to TikTok or other social media platforms for their health information. Um, how do you best like direct people into what sources to follow or how to vet that information when it comes to getting factual information about health? No, that's a big one. Who wants to go first?
I could go first.
Okay.
Kimberly, you went first last time, so I'll start on this one. That is a great question. It's something that we're talking a lot about internally at PHCC. The evolution of social media and technology is something that we as communicators have to pay attention to. As much as we might not like TikTok, as much as we might not think that there's quality information on Instagram, we cannot be blind to that is how generations are now receiving information. People these days, no one is coming home from work and turning on a news program on their TV and sitting down and catching up on news. It's just not happening. So it's something that we're actively admitting and facing and talking about when we are thinking about new approaches to communication. I think that means you got to ask yourself that question too when you think about putting communications out there. We have to recognize that people's attention spans are much shorter. You have people's attention for a much shorter period of time, and that people really like, 10 to you could maybe keep them engaged for 15 seconds at a time. And so what we're thinking about at PHCC is how do we get quality information into short little bites. And so we've been tackling it and thinking about it. And so we're starting a new program in 2026 about on video production and media and how do we begin to transform public health communications out of traditional long newsletters, really long reports that people don't tend to read, into shorter form video content. But Jacquelyn, what you said is right. What we can do right now is just have people double check. And that is I think one of the best messages to push. When you see people collecting information on TikTok and Instagram, and and you hearing about it in conversation, I think it's just important to ask, like, are you sure? Or like, what was the source of that? Or like, let's find that again and talk about it and begin to open longer form conversations to digging into those materials. But I do think it's a great question that we're grappling with actively right now as the world changes with social media. Yeah.
For sure.
Saying that too, as someone that is young and engages in social media.
Yeah, it's a really great question and a really challenge. And I think that going off a lot of things that Bethany said, and also about knowing your audiences and where they are. And we would like for people to dig deeper and find real sources of information. But the reality is, if we know our audiences and we know where they are, then they're on social. And so we have to go to them where they are. And so if we want to provide them with accurate information, then we have to come up with the ways to be able to do that on social and meet them where they are and engage with them. And so some of the things that we're really working on is identifying some of those influencers that make sense for our people in our partner network to partner with so that we can have more frequent conversations on social media in the spaces and places that our audiences are.
Okay, excellent. Yeah. And, right. I love that, Kim. Actually, if you can't change who the influencers are, but can you help influence some of that information, right, with health information? And I think my expertise as a parent, right, I always say, well, who is that person, right? What do they do? What's their background? Do they know about this, thing that they're recommending? Do they have any expertise in it? So that's just as a parent, right, what I would say to my kids. But we're kind of coming to a close here, and so I'm wondering if there's one last thing or resource that each of you would like to share with our attendees.
I think in the spirit of us being at the end of a very challenging year in public health and public health communications, I would encourage you all to read the Resilience Guide that we just published right before the holidays. There's some really wonderful nuggets in there that you can take up yourself or impart to your audiences and your communities to take care of themselves. And I just really hope that you all are able to find some rest and relaxation as we head into this holiday season. There's a classic saying of like, you can't keep pouring from an empty cup. And so just find times to repair and rest and take care of yourself.
Thank you. I co-sign that, and I will be also looking up the Resilience Guide and sharing it at Health Equity Works because that is one of the most important things. I think that if I could point back to some resources that matter the most on our site right now, would really be pointing people towards the Speakers Bureau. We make up this space in this field, and we have to be the people that are speaking about this and helping people understand what is going on. We can lean into social media influencers and all of those things, or we can become the influencers in that space, right? We have the opportunity to do both. And so getting the training, which is free, but if you were to do it individually, would easily be a $20,000 or more training. But the opportunity to really cultivate your own thought leadership and help others develop that is so important as we continue to move further away from traditional media sources.
Right. Well, I just want to say thank you to you both. Several resources that we've shared today that we'll be following up on, but I think they'll be really valuable. If we can also have the slides put up, there's a few other resources that we wanted to share from other partners. You may have seen in the chat, our partner, Adrienne Ammerman, has an opportunity open through ArcLit, which is an all-in-one platform for sharing evidence-backed health communications. And she's offering scholarships for a full year of access to her tool, ArcLit. Those applications, the link will be shared, and those applications are due on December 15th, but that might be a great resource. We also have some things listed, and I think we've shared already from the Access or American Speech Language Hearing Association's framework around 6 core principles to help lessen communication barriers. We also have a resource from the Healthcare Language Access Group about working remotely with interpreters. There's some information from Vaccinate Your Family around toolkits and a toolkit with infographics around respiratory season, the respiratory season, and just different health information you could share there in both English and Spanish, as well as the Beaumont Foundation's Communicating About Public Health with Policymakers toolkit, which is another recent resource that you all have released. So look out for links to those resources. We do have a poll open right now. So if you'll respond to that poll, we'd love your feedback. And then as we wrap up our last slide here, we welcome you to just follow us on our social media not just us, but also our partners here, the Public Health Communications Collaborative, as well as the Health Equity Works organization. You can receive lots of good information on social media. And also just look out for other learning opportunities that we'll have planned for you in 2026 as well. So again, we thank you all. We thank you, our speakers, both Kimberly Hall and Bethany Kuerten. And we just thank everyone who attended today for your time, your participation. We're wishing you all a wonderful holiday season, and we look forward to seeing you in the new year. Goodbye, everyone. Stay well.